Mr. Brad Hazzard is speaking.
All of the social distancing requirements very, very seriously. What it means is we look at the rate of actual positive tests. It's roughly, give or take, around about 1 in 100, and that's what it has been for some weeks. So I don't take a lot of solace. I don't think we can get too excited about that result at this stage. I also want to just draw people's attention to the fact that we reported yesterday, New South Wales Health reported yesterday that there were 2,857 positive cases in New South Wales. Health has now revised that figure, and I'll ask Dr. Selvey to explain why in a moment. It's now 2,847 to yesterday rather than the 2,857. When you add the 7 new cases, it means today we now have 2,854 cases in total. Total people tested right across New South Wales, 141,777. So it's an extraordinary number of people who've been tested, and New South Wales leads every other state and territory by a long shot when it comes to the number of people tested. I want to remind young people, particularly, it seems like older people have got the message and understand the danger to them, but younger people are still out and about, and that's great in terms of getting out for exercise, but you do need to maintain your social distancing. You are as vulnerable as any part of the community in the sense of actually getting this virus. In fact, for people under 40 at the present time, the total number of cases are 1,206. So that represents 42% of all people. 42% of all people who have actually been infected with this disease in New South Wales are under the age of 40. So my message to you is, on a beautiful Easter, certainly get out and about, exercise. It's good for your mental health, it's good for your physical health, but keep your social distance and recognise that in some areas where the propensity has been for you to, or for people to gather in greater numbers where social distancing couldn't be maintained, our state police, our New South Wales police, and councils have taken steps to close some of those areas. The reason they've done that is because people were ignoring the rules around social distancing. It's not out of some desire to deny the community the right to our great outdoors, which we all love here in New South Wales. It's simply to keep you safe, your family safe, and keep the community safe. So if you can get outside and enjoy the sunshine, build up your immune system and your vitamin D, that's a good thing, but stay 1.5 metres away from the nearest person. I also want to just acknowledge that at Easter perhaps it's the right time to be talking about this. We all need to be looking after each other. I have concerns about people's mental health in this particular crisis. As the Health Minister here and Minister Bronnie Taylor, who is the Minister of Mental Health, we share strong concerns about people's mental health. So in a sense, I would ask all of us to focus on bringing back that community, that sense of community. I will remember when I was much younger, everybody knew everybody in the street. Not so much now. So strongly ask the community to come together and be kind to each other, look after each other. And if you know you have a neighbour who's by themselves, knock on the door and just ask how they're going. Try and have a chat. Or if you have social media opportunities where you can even do it with somebody else through social media, use social media. Use this thing that I've only learned about recently called Zoom and other types of social media where you can be in with family members and in with friends, but also in with neighbours without actually going into their house. I'm very pleased today to be able to confirm some changes around pharmacy and GP arrangements. But before I do that, and David Heffernan, the President of the Pharmacy Guild, will have some more to say about particularly the pharmacies, I want to thank particularly our general practitioners and pharmacies. General practitioners have had to change the way they do business, the way they look after patients. We as consumers of health shouldn't forget to look after ourselves in a normal way. If you have other health issues, look after yourself. Make sure you are still having those issues looked after. Our hospitals are open, and again on Tuesday, hopefully all the general practices will be open again. You need to look after yourself. I attended my general practitioner last week and had indicating perhaps my age here, but I had both a pneumococcal injection and also a flu shot. It is important for people to recognise that if they're in certain categories, they certainly should have pneumococcal if you're older, and certainly flu shots to keep your immune system up. Obviously, if your immune system drops because you get the flu, then that makes you more vulnerable to this evil virus that's doing its damage across the world. But I want to thank GPs because they've set up different ways of doing things. My GP has basically no one going into reception. You sit outside in various chairs that are socially separated, socially distance separated, and when you're ready, when the GP is ready, he or she takes you in. In my case, she took me in and gave me those injections and looked after the rest of my health. Please, to the community, don't forget to look after yourself that way. Pharmacies. I mentioned yesterday that my pharmacy now has arrangements where people line up on the street and have the social distancing so that people are not all jammed in there and not getting an opportunity to pass on the virus if they happen to have it. I'm going to ask, obviously, David Heffernan to say a little more about what the pharmacies are doing. But the great announcement today on GPs and pharmacies, I want to thank the federal government for the work they've done in changing the way doctors can actually be rebated through Medicare. So doctors can now have a rebate if they talk to you over the phone, and that's obviously desirable, saves you going into their surgery, saves you doing unnecessary visits, and obviously reduces your likely exposure to any issues, whether it be COVID or whether it be flu or anything else. You can actually ring into your GP. Your GP will get a rebate through the Medicare arrangements, compliments of the federal government's changed arrangements, and that GP can now send, or will be able to, as from the 17th of April, so a little bit of work to do yet to get the regulation finalised, but as from the 17th of April, the GP, having decided you need a particular prescription, can then pass it to the pharmacist, and the pharmacist can make the arrangements. I'll ask David Heffernan how that might be done to get the necessary medications to you. So my final message today is just be kind to each other and keep that social isolation going, because that's what we all need to keep not only ourselves safe, but our family, our friends and our community. I'm going to ask Dr. Selvey, who, as I said, is Deputy Chief Health Officer here in New South Wales, to just address a few issues. Dr. Selvey.
Thank you. So I'll start off by explaining the difference in the number of cases that we've reported yesterday compared to today. So we found that there had been 8 people who live in Queensland and who are in Queensland, and 1 person who lives in the ACT and is in the ACT whose swabs had been tested by a New South Wales laboratory. And because it was tested by a New South Wales laboratory, those reports were sent to us, and we had counted them in the numbers from yesterday. That makes a total of 9. So those cases are now being handed back to the relevant jurisdiction and are no longer counted as New South Wales cases. And there was an additional report where there had been a test first reported as positive, but subsequent testing showed that to be negative. So that makes a total of 10 that had been previously reported in New South Wales as New South Wales cases, which we've now taken off. So then, as Minister Hazzard has said, there were 7 cases from yesterday, and that makes a total of 2854. So I'd also just like to stress again, as Mr Hazzard has also done, is that this really reflects the low number of tests that were done yesterday. So a total of 840 tests when we had been doing around 3,000 to 4,000 every day this week. And that's reflective of the Easter holiday. While some GP surgeries are closed, the COVID clinics and the hospital emergency departments are certainly open, and we are asking anyone with symptoms to please go and get tested. It's really important that we find cases of COVID-19 so that public health measures, contact tracing can be put in place to interrupt any further spread of COVID to other people. Yeah.
Thank you, Minister. Just an update from yesterday. We're pleased with the operation that's repatriating people from the hotels in the city. Yesterday we returned over 1,000 people to their homes after their 14-day quarantine, and the operation continues now for a number of days and possibly weeks, and that's going smoothly. We're also pleased to report that the number of vehicles on the roads at the moment is low, and we want to thank the public for adhering to the messages about staying off the roads unless necessary. Just wanted to remind people though that Operation Tortoise remains ongoing until midnight Monday night, and double demerit points are in existence until then. Overnight there's been over 100 infringements for breaches of the public health orders, and on one occasion there was 19 infringements offered in one instance where more than 19 people had congregated for the purposes of street racing. Traffic and Highway Patrol police arrested those people and issued those orders. I find it astounding that people, one, congregated on the basis of an illegal act, but that they came together during this period. So the message is to anyone to stay at home unless there's a reasonable excuse. Otherwise, you will be stopped and you will cop an infringement.